Hi, class. So this is response 2 for the video clip to the bone. I'm going to do a conceptualization and talk about some interventions that I would do for this family. So as far as the conceptualization goes, I think that it's pretty safe to say that the problem that's being presented to us is coming off as that Ellen is anorexic and needs help. But I think that using the strategic approach, we can really see that it's more of the communication in the family. The family dynamic is what the problem is. Ellen's anorexia is much more a symptom rather than a cause to the family turmoil. The turmoil in the family has been going on, sounds like a lot longer than Ellen's anorexia. So I think the important thing for Ellen, we need to recognize that she's obviously very ill and she definitely needs help because we know that anorexia can be fatal. So how can we help the family to be supportive towards her, to change the family dynamic, to be healthy for themselves and healthy for Ellen and her recovery? So one of the things that I did was I wanted to look up what causes anorexia. So that way we can get a better idea of what might be going on with Ellen and what may have happened in her past that is contributing to her disease. So we can tell that Ellen's family is not communicating well, but could this be contributing to Ellen's disease? Short answer, yes. According to the Center of Discovery, which is Eating Disorder Treatment, it's a website online that talks about specifically eating disorders, anorexia stems from underlying triggers and it could have a genetic component. Some causes of anorexia can be from trauma such as abuse, witnessing an attack, disasters, or war, but also from emotional, physical, and verbal battle wounds, meaning that the person was possibly disciplined harshly, bullied in school, or constantly compared to their siblings. According to WebMD, people with anorexia believe that their lives would be better if only they were thinner. They tend to be perfectionists and overachievers. Many experts believe that anorexia is part of an unconscious attempt to come to terms with unresolved conflicts or painful childhood experiences. So it sounds like it's possible Ellen's anorexia is a symptom of this long-running family conflict. The part we're talking about being compared to siblings made me think that it is possible that Susan, the stepmother, could be comparing Ellen to her sister Kelly. There's obviously a lot of turmoil that happened within the family system with her parents getting divorced, her mother coming out as lesbian and being with her best friend, and having the big family shifts that are occurring with her parents separating. There's also the fact that we've talked about previously that the family doesn't seem to really know Ellen, doesn't really seem to know what her likes or interests are. And she's an artist, so she could very well be a perfectionist or an overachiever and is really trying hard to be the embodiment of what both of her families want from her. And when she falls short, she's acting out with her eating, because that is what she can control, is her eating habits. So it could be some possible interventions for this family. The main thing would be to help them with their communication and to create a healthy and open family dynamic. So one intervention could be reframing, which is to help the family shift the definition of a problem respectfully and honestly. So with this, we could help the family understand that Ellen's anorexia in the family isn't necessarily what's making this family unhealthy. It is the dynamic of how they communicate with each other, the lack of boundaries, and the way that they all work together as a unit. So by reframing and talking to them about how this is the case with what we see going on with the family may help them to make some long-lasting changes in their family. Another one would be restructuring, which supports a family in changing how they respond to each other. One way to do this for this particular family would be to recreate communication channels, which is having family members talk directly to each other, not about each other, and doesn't involve saying it to the therapist or the family as a whole. So with particularly Susan and Judy, which is the stepmom and bio mom, have them hash out their differences directly to each other. Not talking bad about each other, not making catty remarks to the therapist or to the daughters, but to speak directly to each other. Because something that you notice in the clip is that it doesn't seem like anybody is talking to one another, specifically making eye contact and engaging each other. Everything is really more of just jabs and kind of some low blow comments that they make. So I think that having the family communicate directly to each other may be very, very helpful. And another intervention that we could use would be manipulating space. And this involves moving the family around the room to change where they sit, even in session. You see in the video that Kelly and Susan are sitting next to each other, which is the stepmom and the daughter. And then you see Olive and Judy sitting next to each other. And then you see Ellen kind of just closed off from everybody, and she's sitting next to her therapist. So you can tell that they're really kind of grouped off from each other. So what a strategic therapist could do is to maybe move Ellen next to Susan and move Kelly next to Olive, and really switch this family around, so that way they're not necessarily in their comfortable little bubbles and being snug with the person that they're closest to. It's getting them into an uncomfortable space, so that way they can really take in the whole family unit together. And according to Davis and Nichols, which is our textbook, this should help shift inflexible family rules, roles, and coalitions. It should help strengthen the family system. It should improve communication, and it should it should help them understand and help them to better handle challenging situations, because Ellen's disease is a challenging situation. So this is really going to help them to be able to stand united and be a really strong support system for Ellen as she gets through this treatment and this recovery. And it should also improve the home environment too, for everybody. We have to remember that this family is co-parenting. And the stronger the parenting systems can be, it's going to be better for not just Ellen, but for Kelly as well, because we don't even know what might be going on with Kelly. Kelly might be dealing with her issues in a completely different way, because she's experiencing the family similarly to how Ellen is, but how she's coping with it, we don't know right now. So those will, I think, be really helpful interventions to get this family back on the right track and hopefully get Ellen well. Okay, thanks guys.